I spoke about why uptake of HPV vaccine has been so low in the United States, and the reasons are multifactorial. There's reasons that relay policy issues around school vaccination mandates. There's also community level reasons, such as being able to vaccinate in schools or potentially in other alternative settings like pharmacies, and some of the structural issues that come up around that. And then there's interpersonal and personal reasons that kind of relay sort of very specific to patient-provider communication about the vaccine. And I generally focus around that area because we know adolescents are going to primary care doctors, their pediatricians, their family medicine doctors to get vaccinated and to seek health care. But what we tend to find is that providers aren't doing necessarily a very good job about communicating about HPV vaccine. And so a lot of my research is focused on, well, what are the effective ways that providers can communicate about the vaccine? What's a very clear way to make strong recommendations that are clear and concise to parents and easy for them to understand the importance of the vaccine? So one of the things that I work on with some other colleagues is this communication technique that we call that takes into account some presumptive approaches to communication. What that essentially means is that it presumes that parents are ready to vaccinate. And this actually cuts through a bunch of the ambiguity around vaccination. It doesn't pose it as a question or as an optional service. It really frames the discussion about this is the best clinical practice around doing a particular cancer prevention service, and this is what I believe to be important for your child's health. So one of these approaches, it's called the announcement approach. It's been developed by Dr. Noel Brewer at the University of North Carolina, who I had the privilege of working with on developing this communication technique. And the idea behind it is you just simply state that the child is due for vaccinations. You lay out the different types of vaccines that they would be getting, naming the specific diseases that the vaccines are supposed to prevent, and then saying that at the end, you're going to give it at the end of the visit. So it would sound something like, Sophia is 12 now, and at that age, she's due for a couple different types of vaccines. They're for meningitis, HPV cancers, and the whooping cough. We'll give those at the end of the visit. That simple statement right there usually gets parents to vaccinate, and that's what the research is showing. It's just a simple statement that just presumes parents are ready to vaccinate. Even hesitant parents, it gets them over the hurdle. But say they do have some questions, or they are a little bit hesitant, they want to get more information. Well, then we also teach, we train providers on how to actually communicate with parents by effectively addressing those concerns. And the ideas come from motivational interviewing, where you hone in on the specific concern that the parent is having, and then you provide them some information about that in a very clear and concise manner. And then you do a full circle by at the end of providing that information, you give a strong recommendation that I believe strongly in this vaccine that prevents against cancers, and I think we should be getting it today. And so there's a lot of information out there. It's a particular technique that's actually endorsed by the National Cancer Institute, and these presumptive approaches tend to be pretty robust in terms of interventions for actually improving uptake.